of the Yaba Voice webinar. This is the first outing for the year 2025. And we're glad that we are all here. And not just that we are here, we are all thriving mentally. And that's why today seems very, very important to us because we want to kickstart the year on a very wonderful note. The topic today is something that should help us to be able to navigate the year and help us to be able to function as adequately as possible. Before I run off, the medical director is here to warmly welcome us and to introduce the concept that we're discussing today. Please welcome with me Dr. Lubenga Adekile Owoye. Over to you, the medical director, sir.
Thank you very much, Dr. Kemi Akintoyesi. I hope I'm audible. Good day, everyone. I warmly welcome you to today's webinar, the first of its kind in year 2025. This webinar is being organized by Yaba Voice, the social media platform of Federal Neuropsychiatric Hospital, Yaba, Lagos. This platform is for mental health education, advocacy, and community outreach. Today's topic is coping strategies for thriving in a challenging world. Coping strategies for thriving in a challenging world. As we all know, there is no health without mental health. This is because health is hinged on three tripods of physical, mental, and social well-being. And all these three are very important for thriving. Mental health, however, can be compromised by many factors or challenges, some of which operate early in life or around the time of onset of the mental illness. The individual's ability to recognize early warning signs and take appropriate action will go a long way in the promotion of mental health. In today's webinar, some questions will be addressed. What are these factors in the world today that can challenge our mental well-being? Are these factors preventable? How do we maintain sound mental health in the face of challenges? And how can we promote a sound mental health? To address this topic this afternoon, I have two mental health professionals on the platform. The first is Dr. Arit Esangbedo. Dr. Arit Esangbedo is a dedicated mental health and behavioral health expert who reaches out to everyone who seeks help in any of these areas. She helps her clients and families to attain health and well-being for holistic living. She's committed to ensuring that mental health takes a center stage in the Nigerian healthcare system, while lending her expertise in ending the strangulating stigma that surrounds the ordinary individual seeking mental health. Arit's educational qualifications include Bachelor of Medicine and Bachelor of Surgery from the University of Calabar, Cross River State, Nigeria, and also an MBA in Healthcare Management from Warden University, Baltimore, USA. And she also holds a fellowship of the West African College of Physicians in Psychiatry. She enjoys dancing, having fun with family, friends, and reading novels. She is happily married with two beautiful daughters. Our second presenter on the platform today is Francis Akekumi. Francis is a therapist, a researcher, and a seasoned clinical psychologist. His area of expertise include, but not limited to, managing children, adolescents, and adults with emotional and behavioral challenges. He holds Bachelor of Science in Pure and Applied Psychology and Masters in Clinical Psychology. And at present, he is a doctoral student in the clinical psychology at the University of Ibadan. Francis is a licensed clinical psychologist and a registered member of Nigerian Association of Clinical Psychology. Currently, he is an assistant director of clinical psychology at the Federal Neuropsychiatric Hospital, Yaba, Lagos. He is the author of the book, Living Well and Healthy with Emotional Intelligence. I want to encourage all of us to kindly relax this afternoon and listen to our mental health experts as we promise you a rewarding session of today's webinar. Over to you, Dr. Kemi Akitoyese.
Thank you, Medical Director, for that arousing welcome. Once again, we want to welcome everyone to the first webinar of the year 2025. And like the Medical Director said, there is no health without mental health. And that's why we are starting with this very important information that you need to be able to help you navigate, not just that you will thrive, not just that you will live, but that you would flourish and then you'll be able to live healthy. To kickstart this conversation for us today is Dr. Harriet Sangbedo, who is going to tell us what is mental health, maybe starting from the basics with all of us, because sometimes on the street, when you ask people what is mental health, the first thing that they come and say is, oh, you are mad, you are sick, and quite a whole lot of things. But what exactly is it that we're talking about when we talk about mental health, and how does it affect our overall functioning? Over to you, Dr. Sangbedo.
Okay, thank you very much, Kemi, for that question. I'll simply give you the definition of mental health as taught to us by the World Health Organization. Then I'll break it down into a simpler understanding so that the lay ones out there can understand and follow what we're discussing. So WHO has described mental health as a state of mental well-being, which includes emotional, psychological, and social well-being that enables people to cope with normal stresses of life, help them to realize their abilities or full potential, help them to learn well and work well, and helps them to contribute in their community. In essence, mental health is essential at every stage of life, from childhood to adulthood, and influences the overall well-being, productivity, and quality of life of an individual. So when mental health is not stable, individuals are unable to function effectively in their personal and professional lives. They can manage stress, they can adapt to changes, they can maintain relationship and make sound decisions when their mental health is intact. However, when it is compromised, it can lead to difficulties in daily functioning, strained relationships, can decrease productivity, can cause an increase in the risk of developing physical illnesses. Now, poor mental health can also contribute to disorders such as depression, anxiety, chronic stress disorders, which can then negatively impact one's ability to perform their everyday task. Thank you.
Thank you so very much, Dr. Esangbedo, for kickstarting that for us. And she had gone ahead to not just define what mental health is, but she had also told us some of the manifestations that you would see and how it tends to affect us, especially when we talk about poor mental health. Now, Mr. Akikumu Francis would also follow up with this to talk to us about what are those factors that can affect our mental health. Vis-a-vis, when we're talking about our mental health, ability to be able to navigate and other things like that, what are those factors that can significantly affect our mental health? Over to you, Mr. Francis Akikumu.
Thank you so much, Dr. Akitoishi, for that question. A lot of factors can affect the mental health of an individual. Many, including family history of mental illness. There is higher vulnerability for an individual mental health to be compromised if an individual comes from a family where there is positive history of mental health issues, especially if this individual is unduly stressed up in the presence of this vulnerability. Secondly, it is also important for us to know that undue stress, accumulated stress, prolonged stress can also compromise the mental health of an individual. We are living in an environment whereby there are some level of stress that will enhance performance. But when this stress becomes prolonged, undue, unabated, and become chronic stress, it can contribute to worsening the mental health of an individual. It is also important for me to talk about traumas, especially traumas either from childhood that were not resolved. When it becomes to a level that it erodes the resources of that individual to cope, it can affect the mental health of such an individual. It could lead to conditions such as post-traumatic stress disorder or acute stress disorder. There are individual personality, like those who are having traits of neuroticism and who are unduly introverted, or people who have perfectionism. These kind of personality traits can contribute to worsening issues of mental health in an individual. Poverty or lack of social support, among others, are factors that can make mental health of an individual to deteriorate or to compromise. Lifestyle, such as use of alcohol, smoking, and use of psychoactive substances can also damage certain parts of the brain and compromise the mental health of an individual. Thank you.
Thank you, Mr. Kikume Francis. And you know what he had said to us now is there are indices or there are factors within our environments that could jeopardize our mental functioning. And when he mentioned accumulated stress, what comes to mind is a lot of us are going through stress on a daily basis. Now, I understand that when Dr. Esangbedo earlier was talking about mental health, she mentioned the fact that being able to cope with normal stress. But you begin to ask yourself, what we're going through, is it normal or abnormal? Maybe our speakers will be able to tell us, well, how do we delineate? How do we define normal and abnormal as we move on? Because quite a whole lot of people are going through different things. And it's like the more you're trying to cope and deal with one, another one is coming up, which is even making it very difficult for us to be able to cope. And again, poverty. If you look at the rate of poverty in the country now, it's so huge. No, it's alarming, and a lot of people are just struggling every day to be able to just meet up with fulfilling their responsibilities. Let's go on in this conversation because they will be able to tell us what are the signs of not ineffective coping. When an individual is not able to cope effectively, how do we see this? How do we know that? Please remember that you can call family members and friends to join this conversation today so that they can learn firsthand from our speakers on this very important conversation that we are talking about. If they are not able to join us on the Zoom, then please they can join on Facebook. Facebook is just go to Yaba Voice Facebook Live, and then they will be able to join on this platform. All right. So, Dr. Salvador, what are the signs of poor or ineffective coping that we can see in an individual?
Okay. Thank you once more. So, what do we understand by poor coping? Poor coping. Let's just say when they say someone can't cope or has a poor coping mechanism, this just refers to ineffective strategies, or we can say maladaptive responses or maladaptive strategies that one uses to handle stress, adversities, or emotional distress. And this can manifest in different ways. It can affect the person's thoughts, it can affect the person's emotions, it can affect the person's behavior. So I'm going to just talk about some of the signs and symptoms of poor coping. So we're going to look at the emotional symptoms. For emotional symptoms, you can have things like persistent feelings of sadness forward to mood swings. You're happy 1 minute, you're sad the next moment. You get easily irritable. You have emotional outbursts or just minor incidents, minor issues, something that shouldn't even make you respond the way you're supposed to. You now shout or become very angry and want to go into a fight. You feel overwhelmed and at times helpless. Okay, I'm in this situation. There's nothing I can do. Let me just sit down here. Anything that happens to me, I'll take it. Now, for behavioral symptoms, you can have things like you avoid responsibilities. You don't want to interact, no social interaction. I rather stay on my own. You engage in the use of substance. My fellow presenter had also mentioned some factors that can cause all these problems. So poor coping can make you now begin to engage in substance abuse use of alcohol, excessive medication. Also, loss of appetite or overeating. So it can be you're eating too much or you're eating little or nothing. You can also have problems sleeping. You can either sleep too much or you're not sleeping at all. There can also be things like increased reliance on unhealthy behavior, unhealthy distractions, such as gambling, excessive screen time. You spend too much time on your phone, you spend too much time watching TV just to escape from an adversity. You can also have the cognitive symptoms. So for cognitive symptoms, you have things like difficulty concentrating or making decisions. You have persistent negative thoughts or self-esteem. Everything you're thinking about, negative. Oh, I can't do it. I will fail. I will not be able. Can't I just die now instead of face this thing? Oh, it is my fault that all the everything went awry. You know, self-criticism. You may have memory problems or brain fog or mental fatigue. You can also have overthinking. You're thinking about every and anything that comes to your thought. You sit down there, ruminate on it from morning till night. And you can also have excessive worrying. Now, for physical symptoms, you can have things like chronic headaches, muscle tension, body pains, fatigue. You don't have energy to want to do anything. You might have issues with your digestive system, nausea, vomiting, frequent bowel or constipation. You may have things like increase in your heart rate, that's palpitation. You feel your heart beat all the time. And you might have problems with breathing, difficulty breathing, just because of this stress. So if all these symptoms are left unaddressed, poor coping mechanism can lead to long-term psychological distress and a reduced ability to handle future challenges effectively. Thank you very much.
Mm. No, I was when she was just talking about all of these things. What was going on in my mind is I've been having some bit of ache and pain for a while, and I'm wondering and asking myself, is that I am coping poorly? She will still have to diagnose and help me at the end of this. So, for as many of us that have questions, please let's drop with them in the chat so that our speakers will be able to address them before we wrap up the webinar for today. But Dr. Harriet will still have to tell us subsequently, maybe later on, how many of the symptoms do you have? Because I have one or two from what she had mentioned. I hope I'm not in that category, but I would class myself as being able to cope effectively. We'll come back to her, then she will be able to tell us some of these things that's coming up in the course of this conversation. All right, so Mr. Kikumi Francis is going to talk to us subsequently now about emotional intelligence and how does it help us in coping with life challenges. Remember that the topic that we're considering today is coping strategies for thriving in a challenging world. And we have looked at some of the factors that could affect our world and our ability to cope. But how can we thrive? What are those strategies that we can adopt or utilize that would help us to be able to thrive, flourish, do better, and live effectively? Mr. Kikumi Francis, how can emotional intelligence help us to be able to cope effectively? Over to you, sir.
Thank you so much, Dr. Akitoyeshe. Beautiful question. And let me first and foremost say that emotional intelligence is that soft skills that helps an individual to understand his or her own emotion, interpret the same emotion, including the emotion of others. I would say very importantly that emotional intelligence is that master key that can help an individual not only to thrive during challenging situations, but also help prevent an individual from entering avoidable challenging situations. The beauty in emotional intelligence is exemplified in the ingredient, what I term the ingredient that makes up emotional intelligence. And the ability to learn emotional intelligence, utilize it, and live a lifestyle of emotional intelligence, utilizing those ingredients will help an individual to thrive in any unfavorable condition. One of these is self-awareness or emotional awareness. We all recall at one point or the other in our life when we have experienced one challenging situation, several emotions run through our mind, from unhappiness to anger, etc., etc. Ability of an individual to identify what kind of emotion he or she is experiencing at that point in time will go a long way in helping such an individual to address way out of dealing with that emotion. Not only that, there is an ingredient I call impulse control. That is the capacity, a soft skill an individual employ during challenging situations when anger comes that helps an individual to manage that impulse, manage the anger, the feeling of anger. And we know that negative expression of anger has caused a lot of havoc to people, both internally and externally. Emotional intelligence, being skillful in anger management skill, helps an individual to live a life that will help him to overcome the negative consequences that poor impulse control could have caused. Very important ingredient of emotional intelligence is social skill, ability to manage social relationship. And in terms or in period when there are challenging issues, ability to connect with individuals that can be empathic in nature to help such an individual cope goes a long way in expressing emotional intelligence. When you are going through a situation, who are the people around you that you can connect with? How can you navigate these resources to help you get over the challenging situation, especially if you connect with those who are empathic, who can put themselves in the same shoe you are at that point in time, goes a long way. And very, very important also is flexibility. During challenging situations, an individual must be flexible and also adapt to situation. Being rigid will create a lot of psychological distress, but being able to navigate through flexibility and adaptability, which are emotional intelligence skills, will go a long way. We can see what is happening in our country today. Prices have skyrocketed, a lot of issues are going on. An individual ability to become flexible in the midst of this situation will go a long way in helping coping with this something. Then, very importantly, is motivation. Being able to move on positively without the adversity, looking at the good side of whatever is happening and be able to make use of that goes a long way in helping an individual to develop resilience and being able to bounce back in the face of that adversity. Thank you very much.
Thank you so very much, Mr. Kikumi Francis, for that. No, it started by defining emotional intelligence. And what he said was it helps is about understanding emotion, interpreting emotion, managing your own emotion as well as the emotions of others. Now, one of the things you would say in our world today, because if you remember what Dr. Ariet Sangbedo mentioned earlier, is about mood swing and irritability and quite a whole lot of other things like that. And so if you're not able to understand why or what is going on around you, the ability to be able to manage it will be zero. Now, not to even talk about managing other people. And that's why you will say, greet somebody, good morning. And then the next thing the person is asking you, what is good in the morning? Because, quite a lot of things going on in the world. Now, Mr. Akifumi also said something very vital, and which is also raising a lot of questions in my mind, and that's the issue of motivation. Now, if you keep you get up in the morning to go out, do your day's job, and quite a lot of challenges. The situation seems not to be bulging. Life seems not to be giving you the things that you want. How can you stay motivated? We will come back to that because our viewers need to understand all of those things, especially when we're talking about thriving. How can you stay motivated in the midst of all those challenges and difficult situations that is going on around us? Now, Dr. Sangbedo will be talking to us about psychological flexibility and it's how it helps us to be able to navigate challenges. Maybe she would be able to answer some of the questions that is burning in my heart because there are lots and lots of things that is going on in our world now. Over to you, Dr. Sangbedo.
Okay, thank you very much once more, Kemi. So let's look at the analogy of a chameleon. So a chameleon would change its skin color to fit into its environment. This is a form of flexibility, adaptability as a survival instinct. So looking at psychological flexibility, what does this mean? It's just like the chameleon. I will change, I'll be a bit flexible just to be able to fit into what is happening to me so that I don't become overwhelmed and develop any mental instability. So psychological flexibility is just the ability to adapt to changing circumstances, accept difficult emotions, and take meaningful actions despite that challenge. It is a very key component of mental health well-being and mental resilience. So for psychological flexibility to help individuals, they must be able to understand and accept that there's something and they need to do something to either change or go around what is happening. So it helps them navigate uncertainties and helps them maintain a sense of purpose even in adversity. So let's look at some key ways psychological flexibility can support coping with challenges. Accept that it is a difficult situation, acceptance. So you must accept that difficult situation. The situation in Nigeria, we are all in it. We are not going to sit in it, but we have to look for ways to work around it. You can't sit there, because I'm helpless. Food prices are skyrocketing. There's nothing I can do. You now sit in it, but you have to eat. You have to eat. So instead of sitting there and avoiding all the emotions that will come with sitting there, psychological flexibility will help you to acknowledge that there's a problem, which it's natural, and then help you to find ways to go around it, thereby helping you prevent all those emotional issues that can overwhelm and allow you to become very ineffective in solving your problems. Another thing is what we call cognitive reframing. Okay, your thought process doesn't necessarily mean that that is a fact. Oh, I'm not good enough. Is it a fact that you're not good enough? No. Why not turn that thought process to, I may feel I'm not good enough, but let me give it a try. Let me go out there and do it. So this is a form of psychological flexibility. It will help you to reframe all those negative thinking that you have and thereby reduce the distress that you may have if you keep on sitting down there in that negativity, and help you cultivate a more balanced way you look at things happening. Another way is commitment to value-based actions. What I mean here is when there are difficult times, You encourage people to use this psychological flexibility to act in alignment with their core values. For example, I'm a very compassionate person. Instead of me to be angry, I'm very angry with the whole world because things are not going well. Why not just think of, okay, I see that man on the street without shoes. Okay, let me just go and buy him a pair of shoes. That way, it gives me some form of relief from that anger that I'm sitting there, I'm thinking why the whole world is about to collapse on me. So I can use that compassion and give myself some form of peace. This helps me to maintain my sense of purpose and motivation despite all that is happening around me. Another way we can look at this is mindfulness. This my colleague has spoken about, but just to throw a bit of light on it, you know, when you're present in it, when you look at a situation and begin to look at things that can help you solve those soft skills he was talking about, you're self-aware that, oh, if I sit in this situation, oh, it can make me begin to use substance. I'm just saying that as an example. Or if I sit in this situation, I may be able to make mistakes that I will not be able to change or correct. Or I begin to sit down and dwell in the past. Instead of sitting down there, try to become more aware of the situation. Okay, it's a very big problem. Why am I looking at it as a very big problem? Can I break it down into smaller problems and see how I can handle them as they come? That's the smaller steps. This morning I said to my daughter, who told me that she didn't want to go to school because she will be punished. And I asked her, why will you be punished? She said, because the primary 5 students, she's in primary 6, the primary 5 students will make noise and the head teacher will come and punish the prefects because they cannot control them. So because of that, she didn't want to go to school. So I said to her, you are looking at the problem. You want to run away. No, don't run away. Break down those problems. One problem is that primary 5 children are making noise. Students are making noise. Another problem is that you are going to reprimand, but they won't listen. Another problem is that you will go and report, but the teacher won't believe that you reprimanded. So break it down, then take it one at a time. Okay, primary 5 students are making noise. You go there. Primary 5 people, you people are making noise. If you don't stop, I will go and report to the head teacher. You've solved one thing. The next thing, you go to the head teacher. Oh, primary 5 children, people are making noise, and I have spoken to them, but they've refused to listen. That is why I'm coming to you. You've solved another problem, you know? So you take the problems one at a time, break it down into little pieces, and then instead of looking at the whole thing. So that's being aware, using those soft skills. Another way we can do this is problem solving and adaptability. So psychological flexibility fosters the ability to adjust to new circumstances, and helps us to develop creative solutions to problem solving rather than becoming sucked up in the rigid thinking pattern that we have. The problem is there. You're okay, maybe this problem was there. I usually would solve it like this. Now, that solving method is not working. Instead of you to move, think of something else. You now sit there, say, oh, no, if it is not this method, I will not use any other one. Another one can be reduced emotional reactivity. You must not respond to everything. You must not respond to everything. You fight some, leave some, you know? So by recognizing these emotions and thoughts are temporary, psychological flexibility can help you to respond thoughtfully rather than reacting impulsively to any stressful situation. So you think, something happens, you think, in my mind, if someone hits my car, I'm not going to come out and want to fight. In my mind, I'm thinking that if I fight this one, I will give you one blow, you fall down and die, then they will come and hold me. So instead, why not just sit in the car? So, you know, instead of just getting also riled up and wanting to express all the emotions in your body, move on. Be thoughtful. You can have a discussion, you know, or you move away if that thing is going to make your emotions go more than what you think you can carry. So by practicing all this psychological flexibility, individuals can build resilience, improve their mental well-being, and navigate life uncertainties with greater confidence and balance. Thank you very much.
Thank you so very much, Dr. Exalbedo, for that. That's beautiful. I know the last thing you said resonated with something I saw on the social media just some few days ago, and I had to just put it down on my status. That now with maturity, I am trying to run away from a lot of drama, less drama, and so that whatever it is, even if it's my business and I don't want to respond and I choose not to respond, I will just walk away, and so there is no emotional pressure, there's no emotional tension anywhere. I love so much the fact that acceptance was what you started with. There are realities that we cannot change, and when we cannot change those realities, the best thing is to learn to work with it and then be able to move on with it. No, you have told us quite a lot, and I hope that for everyone that is on this call with us today, you're taking notes. I am also taking notes now, because the most important thing is we must all be able to thrive this year. We must all thrive so that we can be able to function as adequately as possible. So it's very important that we begin to put all of these that Dr. Exalbedo had mentioned into cognizance. Psychological flexibility is key. When you're rigid, then you will not be able to get out of whatever situation you are in, because most times you're always just looking at it from a perspective. Learn to change your perspective. Cognitive reframing, that's what it's called, and that would help you. So Dr. Akikumi is also going to talk to us about some other adaptive coping strategies that we can utilize to be able to navigate the ambiguity and the uncertainty that pervades our world, especially with what we're dealing with as a nation and even the world generally. What are those other coping strategies that people on this call can take on? Remember that you can drop your questions in the chat box. We will be able to attend to them before the end of the webinar. Over to you, Mr. Akikumi Francis.
Thank you very much, Dr. Ms. Akitoye, and everyone listening. Thank you. It is important for us at this point in time to know that the year we have, 2025, is going to be a beautiful year. There will be so many promotions, so many good blessings from God that we will surely enjoy. But also in this same year, there will be some time that we need to develop adaptive coping strategies to deal with some issues that we are likely to encounter. And very importantly, this is very key for our survival, key to our good mental health, and to our flourishing. Let me talk very importantly on mindset shift. Very important. One thing I want to emphasize in this concept is that what happened to an individual when you are facing an adversity or a challenging situation, that is not the most important thing. The most important thing is your perspective, your belief, your interpretation you give to that challenging situation. Rather than seeing the situation as half empty, you can see it as half full, because through that you can turn your lemon to lemonade. There is a psychological concept that made us understand that the interpretation we give to any situation we are going through is more important than that situation. Let me create a scenario, something that has happened in this country. Two individuals contested election, and two of them, they lost gallantly. They also owe a lot of money. 6 months later, one of those individuals who lost the election feel that, oh, this is a hopeless situation. He went and committed suicide, thinking that, oh, it's not good enough, it's unpopular. He underrated himself. The second individual said that, oh, though election has been lost, going to be another election. And in that another election, he could do better. Rather than committing suicide, no, he connected with other people. And after 6 months, he was still eating pounded yam. So the concept is that somebody will say the first individual committed suicide because he lost election. A psychologist will say, no, both of them lost election, but one refused to commit suicide. Rather, the other one was still functioning. What was the difference? Is the interpretation. So in any situation you find yourself effective about you attribute to that situation is very key, and that will determine the consequences that will follow. So always check your belief system, because as an individual thinketh, so he will or she will be in the future. Very importantly, when you find yourself in a challenging situation, learn to count your blessing. Practice gratitude. Look at the past blessings you have enjoyed from God. Check in retrospect, what are some good things that you have enjoyed? What are some benefits you have gotten? Count them and name them one by one. And it will surprise you that, oh, there is still better future ahead of you. Rather than giving room for depression, giving room to discouragement, you can choose to count your blessing. You can name them one after the other. You can name things you have gotten from human and you have even gotten from your creator. This can build resilience in you and encouragement to make you motivated in the face of that adversity. It is also very important to practice spiritual exercise like worshiping, singing, praying to God. That can boost your mood and can give you more hope and reassurance that through the love of Christ our Savior, all must be well. And surely as you confess it, it will surely be. Very importantly is connecting with people in the face of adversity, in the face of challenging situation. Connect with people of like mind who can render social support, emotional support, even financial support for you at that period of time. The timely intervention of such individual will go a long way. Never say you can handle it alone. There are situations that can be so overwhelming that your own resources alone may not be enough, but other people coming together to support you, just like the man who lost the election. Other people came around him to support him, went a long way in helping him to cope. Similarly, connecting with good people, it could be a student association individual, it could be people in your place of work, it could be friends and colleagues, it could even be in your place of worship. We go a long way in helping you. Learn adversity intelligence. Adversity intelligence is a capacity that will help you to turn a seemingly impossible situation to a situation that will help you to flourish. In other words, you come to a level where you get that understanding that there is no problem anywhere. The problem or mountain of an individual is based on their ignorance, and you can turn that situation into a blessing to you. For example, during COVID, a lot of businesses went down, a lot of people developed anxiety and depression, but some people seized that opportunity to flourish. Their business boomed, and they were able to come out of that situation flourishing. So it is key when you are going through that situation, you use adversity intelligence. Seek counseling or therapist when the situation is beyond your control. Oh, you have tried your own personal effort, it's not working. You connected with other people, it's not working. In order to stay motivated, you can call on your therapist, you can call on people who are experts in that field, or people who know more than you or better than you. The counsel from such individual and the therapy will go a long way in helping you to navigate through and be able to solve the situation. Very importantly, practice avoidance of negative coping strategies. There are so many individuals in the case of challenging situation, they go into medicating those situations and the emotion associated with those situations with some maladaptive strategies, such as drinking alcohol or smoking or using of other psychoactive substances. As much as this may give temporary relief, but the consequences afterwards is usually grievous. So avoid it completely. It will go a long way helping you. Avoid transfer of aggression. Don't transfer aggression on your children, on your wife, on people around you. Don't transfer it on yourself. Don't turn anger inward and go and commit suicide. No, it's not good. It is important that you should come to this realization. One permanent thing in life is change. And the situation, since it has a beginning, it will surely have an end. and the situation will change for better. So have a proactive method to addressing situation. And I tell you, by and large, without long, you will try, you will flourish, and you won't fall into depression. Thank you.
Thank you so very much, Mr. Kikubu Francis. That was very well said. Very, very well said. No, I love when you talked about advancity, intelligence, impossible to possible. So all that you have to do is just remove the I am there, and then whatever it is that looks impossible to you becomes possible. The mountain before an individual is just a function of perception. Honestly, you can reduce it and take it down. Now, as I was just thinking about it to say, don't talk about it, man up. And that's the concept that a lot of people will parade around today. He also mentioned the fact that don't bottle it up. No, you can't handle it alone. Talk with somebody. And I will tell you, that's why we are here at the Federal Neuropsychiatric Hospital, Yaba, to be able to help you go through, navigate challenges as much as possible. If you're having any difficulties, if you're having any challenges, then we are here to help you to be able to deal with issues as appropriately as possible. Okay, so we have quite a lot of comments and questions on the chat box, and I'm going to start with the first one that was sent in by Moses Akko. Yes, greetings, thanks for this webinar. I don't know if it's I quite often to help me out, help me avoid life issues. But Dr. Sagbedo, I want you to address this. I don't have social support, always on social media, mood swing. How can you help me out? So what do we tell this individual? How do we help this individual become better? Over to you, Dr. Sagbedo.
Okay, Moses, I'll just have to say this, that seeking professional help is not a shame. It's not a shame. It will help you to understand what it is you're going through. So you can see therapists here in Federal Neuropsychiatric Hospital, Yaba. You can come in, see any counselor, therapist, and probably join any support group in church, your peers, There's nothing shameful in seeking professional help. This will help you cope better and help reduce any form of anxiety or whatever it is you're going through. It will give you a platform to talk about whatever it is you're going through. So proactivity will address any mental health concerns and can lead you to now develop significant improvements in your overall quality of life. So there's no shame. You can walk in here, and we're always here to help. We're here to listen, and we're here to guide. Thank you.
Thank you, Dr. Esangbedo, for that. Christopher Huku said, thank you, our speakers, for today. I hope the management of the hospital should look deeper into what is happening with FMPHY staff and the economic situation. And like Dr. Esangbedo said, it is not for FMPHY staff alone. What is happening currently in the country is for everybody. That does not mean that the management shouldn't look into issues that contain or that pertains to their staff. You said, and the economic situation in the country for a good motivation factor to ensure that they deliver in all the professional contribution in the hospital. Thank God for emotional intelligence being exhibited. All right, so thank you for that. Mr. Dr. Mustafa Sombe, this your long notes appreciating the head of the Department of Psychology, also appreciating the medical director and everyone on the platform is noted. Dr. Adedoto Ajiboye says, wow, I picked this from Dr. Respond. Dr. Sagbedo mentioned this. Respond thoughtfully. Don't react impulsively. A take home. So there's a question here, Mr. Kikomi, we want you to answer that. Is emotional intelligence teachable? What are the benefits of having emotional intelligence? And then what are the role of cognitive distortion in emotional intelligence? Mr. Kikume, can you quickly address that for us? Thank you.
Thank you very much, your questioner. Emotional intelligence can be learned, be acquired, and even today there are so many courses online where people learn about emotional intelligence. So in order for them to be empowered, interesting. And one very important thing about emotional intelligence is that when you are aware of your emotion, you can identify your emotion, interpret your emotion, manage your emotion. it's easier for you to quickly identify cognitive distortions. And using cognitive restructuring strategies, you can quickly, using that method, to resolve issue of cognitive distortion, whether it's blaming, whether it's rationalization, whichever one you are having, it goes a long way. So emotional intelligence is key, and it is something that every one of us in this our age, whereby we have no control over the environment, we should develop that capacity to manage our emotion. For example, one that emotional intelligence does not see any situation as a problem, but rather they look at how did they make something good out of that situation. And being able to manage your emotion as well as managing peaceful coexistence, both at workplace, both in the family, even in religious organization, even in our country. So many political issues we are having today will have been minimized if people can learn the concept and ingredients of emotional intelligence, because in emotional intelligence, you talk about empathy. Empathy is putting yourself in another individual's shoe. And the Bible says, what you don't want others to do to you, don't do it to another individual. So the benefits of emotional intelligence, they are numerous. It helps you in having positive emotion, having good relationship, and also avoiding mental health issues. Thank you.
Thank you so very much, Mr. Kikumi Francis. Dr. Adedosu Ajiboye says, Mr. Kikumi, thumbs up for you. Count your blessings instead of counting your problems. A very good resilient skill. She also came up to say breaking problems into smaller bits and address them bit by bit. Seek professional help. Dr. Esagbedo also mentioned something similar to that when she was talking about a daughter at the issue with school. Yes, Odo Cynthia, thank you for the thumbs up. Caroline Ajasa, thank God for my mentor who has been my support and help. Zainab to the meeting says, thanks so much for putting this together. Please, how can we get the recording? Oh, yes, the recorded version of this webinar will be on the YouTube page of Yaba Voice, Yaba Voice, FMPHY, one word. Yaba Voice, FMPHY, one word. You would find the recording of this episode on the webinar, and then as well as the previous episodes. So you can as well go ahead and check up for previous episodes of recordings of the webinars that we have had in the past. I can bet it with you that every of the previous episodes are very rich and they have psychological content that would help you. Ogochukwu Okafo says, please, how can, yes, I've answered that. Wally, please put this on the, so Yaba Voice FMPHY, just search out there on YouTube, and then immediately after this meeting, you would get the recording of the webinar. Ahmed says, well done for this amazing session. It was really impactful. Thank you so very much, everyone, for joining us. Before we leave this webinar today, our speakers are going to share with us their last word. That's something for you to be able to take home. Dr. Sagbedo, what's your last word for viewers today?
Thank you very much. Okay, I just want to say that thriving in a challenging environment requires combination of your emotional resilience, adaptability, and self-care. And if you can put all this together, you're sure to develop proactive approaches or develop proactive ways to life obstacles and transform any challenging situation into an opportunity. Like I said before, don't be ashamed to seek for professional help. We are here in Yaba Psychiatric Hospital to offer those help in any ramifications, and we're always here to listen and give all the advices and help we can. Thank you very much.
Thank you so very much, Dr. Esagbedo, for that last word. Resilience, adaptability, stability, these are key things that you would need to be able to thrive alongside with every other thing that had been said during the course of the webinar. Mr. Kikumi Francis, your last word.
Thank you so much. Let me reinforce what I've already said. in life that when you are faced with a challenging situation, work on that situation to turn it to your own advantage. And this will bring me to the story of an animal that fell into a well, a dry well. When the master saw that the animal fell into a dry well, called the community to come and heap sand on the animal. But as each shovel of sands were falling on the animal shake the back and step on the sand. As each shovel, loads of sand was falling on the back of this animal, the animal shake it off and step on the sand. Each sand as it's coming, load was coming, he was shaking them off his back and was stepping on it. The master, the owner already thought those sand will kill the animal, but the animal refused to give up. He was shaking them off and was stepping on it. Gradually, he walked out of the well. And what does that mean? Whatever you are encountering or you are going to encounter this year or ahead, turn them to your advantage. Never allow them to bury you, because that situation that apparently seemed want to bury you, you can turn it to your own advantage and to your own celebration. If an animal could do that, human being could do much better. Thank you, everyone.
Thank you so very much. If it hasn't killed you yet, then you can actually get up from there. And that's what I'm taking away from what Mr. Akikumi Francis just said. Let's keep pushing. Let's keep thriving. Let's put every resources into place so that we can be able to thrive effectively in this challenging time. This cuts across everyone. Everybody's going through a hard time. It's not peculiar to an individual. So let's reset that in our mind. It's not just about me, it's about everyone. But you have a responsibility to yourself to ensure that you thrive. You have a responsibility to yourself to ensure that you cope effectively at this point in time. We stay motivated even in the midst of all that. Mr. Kikumi talks about gratitude earlier on, which is very important. And by the grace of God, next month we will be coming again. And I can tell you that we have something very important to discuss, which has to do with the emotional stability of women, because it's going to be the International Women's Month. And so we are bringing two powerful speakers who will be talking to us about women and their emotional health. I long to see you on that day. Please reach out to us if you have any questions. We are on Facebook, Yaba Voice, or we are on Instagram, Yaba Voice. If you also need to reach us on our email, is yabavoicefmphy@gmail.com. You can also send us a mail and then we would be happy to respond to you. Until we come your way again, thank you so very much for being part of this conversation. The link to access the recording of the webinar as well as other recordings has been posted on the page. So you could just go ahead and search it out. Like we said, Yaba Voice, FMPHY, one word. You would get this recording as well as previous episodes of the Yaba Voice recording there. Thank you so very much. Dr. Adedotu says, FMPHY Yaba, we thank God for your leadership role in mental health in Nigeria. We also appreciate you too for being on this call. Thank you so very much. Until we come your way again, please keep thriving. Remember, there is no health without mental health. Bye-bye.